Okay. Ready?
I got stuff to do. Okay, go. So,
Okay. Go ahead.
okay. Hi, my name is Mark Litman. I'm a paramedic. I've been doing the job for 15 years, working in York Region and in the Simcoe County area. Today, I'm going to talk to you guys a little bit about defib machines and how they work and how they operate. Defib machine works in concert with doing CPR, and hopefully will restart the patient's heart in an emergency situation. The defib machine that we're going to use today, it's called a heart start machine. It is a Philips type of machine. There are many different types of defib machines out in the marketplace. They all basically work the same way. So if this is the type of machine that you come across, that's what this tutorial is going to be using. Otherwise, you'll just follow the instructions that the machine tells you and use that machine. The nice thing about the defib machines, and they're called an AED, an automated external defibrillator, these machines are smart machines, and what they do is they will tell you exactly what you need to know to shock somebody. So I'm going to tell you a little bit about what you're going to see when you get this defib machine, how you place it on the patient, and how you're going to shock them. First of all, when you do come across a defib machine, there will actually be, it'll be in its own little case, and attached to the case will be a little fanny pack. And inside that fanny pack, there will be some items that will be very useful to you when you use the defib machine. The first thing, there will be some gloves. We obviously want you to put gloves on. We don't want you getting any bodily fluids on yourself, blood, urine, feces, vomit, that type of thing. So that's what the gloves are for. We have a pocket mask or a face shield that you can use, because if you're going to be using a defib machine, you are obviously going to be doing CPR on somebody, and it just simply pops open like this. There's many different kinds. You put it over the patient's nose and mouth, and you can now breathe through this top hole. This is a one-way valve that allows air to go in when you breathe into a patient, but if they spit up or vomit, it hits the shield inside here and protects you from any type of contamination. The next item that is also in that fanny pack is a razor. We'll explain what we're going to do with that. A pair of scissors, and you'll also have a little towel or towelette. So let's talk about some of these items. First of all, the scissors are used to cut off clothing. The defib pads, which these are the pads right here, must go on bare, dry skin. So you need to get the clothing off the patient. You can use the paramedic shears that are in the kit to remove the clothing. Bras must come off. Most bras have underwire to them unless they're a sports bra or a training bra, and this underwire will shock a patient, will not shock the patient, and or may burn the skin. So if it's a front clasping bra, just unsnap it, lower it down to the patient's waist, and you're good to go. If it's a back clasping bra, just undo the clasp, roll the patient onto their side, use the scissors, and get the bra down to their side and their waist, and you're good to go. Jewelry must be removed. So if the patient has a necklace on, the paramedic shears can cut through the necklace or just lift it up over their head. If there's any body piercings in the upper chest area, they also need to be removed. For women who may have navel piercings, the piercing in the navel we don't have to worry about. Basically, any jewelry from just above the belly button to just below the neck has to be cleared out, because it will deflect the shock and it could cause more injuries to the patient, or the patient won't get the shock that they need. The next thing we have is the razor. The razor is if you're dealing with a man who may have a hairy chest. We need to shave the area where the pads go. The pads, as you can see on this diagram right here on the defib machine, shows one pad in the upper right of the chest and the other pad lower left of the chest. These are the areas in which you want to shave. I don't want you shaving the whole entire chest. Don't carve your initials in the hair or anything like that. All right, we need you to just shave where the patches go, where the pads go. The desired shave is like a baby's bottom. There is no lubricant for the razors, so when you do shave, you may be pulling hair, and if you do pull hair, you may get beads of blood forming on the skin. This is when we can use the towel. The towel is there so that if you do get beads of blood on the skin, or you have excess hair on the torso, or if the torso is wet, because the pads will not stick to a wet surface, and a wet surface will conduct electricity and won't shock the patient. That's what your towel is for, to wipe down the area, make it nice and clean, and then attach the pads. So these are the items that you will get inside of the fanny pack that comes with your first aid, with your defib kit. So now let's talk about the defib itself. One big question is, can we shock a pregnant woman? The answer is yes. All right, because the amniotic fluid and the fat tissue around the baby from the mother will protect the baby when shocking a mom. All right, one pad goes here, one pad goes here. There are no pads in this area. The baby will be safe. Okay? The machines shock at a level of 200 joules. That is an adult dosage. The child dosage is 100 joules. There's nothing on these machines to allow you to either raise the joules or lower the joules. How does the machine know? It's all based on the pads that are connected to the machine. Most machines will already have connected to them the adult pads. Some machines will not, the pads will not be connected, and you will get instruction onto attaching the pads to the machine. If you attach a child's pad, the machine will recognize the child's pad and then give that child the 100 joules versus the 200 joules. Now, how do we determine adult versus child? In the course of CPR and defibrillation, an adult is considered anyone over the age of 8. A child is anyone between 1 and 8, and an infant 0 to 1. We do not shock infants. So when we talk about anyone under the age of 8, we will be talking about children. And anyone over the age of 8, we will talk about adults. So my question to you is this: can we shock a child with an adult's pad? What do you think? Well, the answer is yes. Because if a child needs to be shocked and you don't have the child's pads and you don't put any pads on that child, the chances are they're going to die. So what we will do is we will still shock that child with the adult pads. Even though they get the extra dosage of electricity, if we get their heart started and it causes any internal injuries, well, at least we did what we needed to do, and that was get the heart started. The injuries internally become an in-hospital treatment versus what we are doing is pre-hospital. If we do not get the child's heart to start and it causes any injuries, then it doesn't really matter in that case. So very important to understand that. What about the surfaces? What surfaces do you think we should not shock somebody on? Well, there are obvious ones: wet and metal, for obvious reasons. So let me ask you this: can we shock somebody on snow? The answer is yes. Snow is water in its solid format. Snow is actually an insulator. So if somebody, and which doesn't conduct electricity. So if somebody was on snow and you need to shock them, would you think they would have a winter jacket on? Possibly. So you would unzip the winter jacket and open it up. Take your scissors, cut down their clothing and open them up. What part of the body is touching the snow? There isn't any, because the chest is up here and the rest of the body is being protected by the jacket. Put the pads on the patient, and if you need to shock them, go ahead and shock them. If you're outside and it happens to start raining or snowing, just take the clothing of the patient and fold it right over top of them. The pads are protected now, so no moisture can get to the skin and you can still shock somebody. Very simple, very easy to do. Now, what about medical patches? Like birth control patches or nicotine patches or nitroglycerin patches. If the patches are on the skin anywhere where the pads go, don't worry about it, leave them alone. But if the patches are here or here where we're going to put our defib pads on, you need to remove them. This is very important because when you put the pads, the defib pads over top of those patches, it will not make contact with the skin, which means it will not transfer the electricity that the heart needs or the body needs to revive itself. So take the patches off. Now, when you do take the patches off, please understand, protect your hands. Put gloves on or use a towel or something so that you can take the patch off without coming in contact with the underside of the patch. These patches are called transdermal patches. Transdermal means transporting medicine via the derma, and derma is skin. So if a person has a patch right here that happens to be a nitroglycerin patch and I use my bare hand and pull it off, I'm going to potentially touch the sticky part of that patch, which has the medicine on it. That medicine is now going to get into my fingers, into my hands, and into my skin. And it may not be good for me, especially for those people that might be on Viagra. Don't want that. So please make sure that when you are taking the patches off, your hands are protected, and then take the patch and fold it in on itself, sticky side to sticky side. So the only surfaces are the outer surface of the patch, which means anybody can touch it now and they are protected. Okay? The last thing we have to make sure about are pacemakers. For those of you that don't know what a pacemaker is, this is a stainless steel surgical device that's implanted underneath the skin to help somebody when their heart drops too low. It gives an electrical impulse which then could zap the heart without the patient even knowing about it to get it back into a better rhythm. Most of the time these pacemakers are put on the left side of the body because that's where our heart is. Well, we don't have to put a defib pad there, so we're fine. But for those, some people have to put them on the right side. If you see a right-sided pacemaker, how are you going to know it's there? Very simple. You'll see a raising of the skin in this area. It'll either be round or square. If that is the case, please take your pad, find the edge of the pacemaker, and move the pad approximately 1 inch to the center of the chest. If you see a scar line on the right side of the chest, that could indicate potentially a pacemaker that's deeper in the skin. Use the edge of the scar line as your point of reference, and then move the pad approximately 1 inch to the center of the chest. That's where your top pad goes, and then your bottom pad would go down on the left side. It's that simple, okay? The pads all have pictures on them. Let me get you my picture here. Okay, so this is what you will see. It shows you exactly the placement of the pads. This particular machine itself that I'm going to show you shows that this particular pad must be the one that goes upper right, and this particular pad is the one that must go lower left. If I reverse them on our patient, the machine will recognize that and tell you poor pad placement. Look down and you say, oh my goodness, I put them on the wrong side, and you're going to reverse them now. So you'll put one back up here and one down here. Some defib machines do not require a certain pad to go upper right or a certain pad to go lower left. They just need the pads to be in the right spot. If that is the case, there won't be any arrows on the pads indicating that this pad must go in upper right. All it will show you is that a pad goes here and a pad goes here. It's that simple. If you put the pads in the wrong spots, maybe by accident you put the pad lower right instead of lower left and upper left instead of upper right, the machine will realize that it's in the wrong spot and tell you poor pad placement. And you'll look and you'll see, oh my goodness, I put them in the wrong spot, and then put them back into the right place. So that is some of the information that I want to tell you about with stuff that comes with the defib kit, and some indications of when you should or should not shock somebody. So now let's look at the defib machine, and let's take a look at the components of the defib machine. This particular defib machine has a pull button here to open it up, the plastic cover, which turns the machine on, or you can press the on-off switch. This machine also has a shock button, which will light up, and we'll show you that when we do our demo in a moment. And what I really like about this type of machine is it's got a blue button here. And this blue button will actually give you a tutorial on how to do CPR if you don't know how to do it, once you get the defib pads on the machine, on the patient, and the machine says shock advised. So it is really a dummy-proof system. If you have a defib machine, you can pretty much leave your brain at home. Okay. So what we want to do is this. If you come across a patient who is vital signs absent and you do not have a defib machine with you, your course of action right now is to start CPR. CPR consists of 30 compressions on the chest and 2 breaths. That is 1 set. We want you to do a total of 5 sets. 5 sets equals 2 minutes of time. After the 2 minutes are done, the defib machine will analyze the patient and advise you whether or not the patient needs to be shocked or there is no shock. If the machine says shock, we'll demonstrate in a minute, you will see the machine fire up. It'll tell you to stand clear and press the button. Before you do press this button, please make sure that the scene is clear. Usually the person that sets off the defib machine will say, I'm clear, you're clear, everybody's clear. Look around before you press the button and away you go. If you are just by yourself and the defib machine is not available to you, you will just do CPR until a defib machine comes. The person that brings the defib machine is going to take a few minutes because they're going to have to undress the chest. They may have to shave hair, take off a bra, remove jewelry. In the interim, you will continue doing CPR. If you have a defib machine with you, when you come across somebody whose vital signs absent, it is more important to get the defib machine on the patient first. Let the machine analyze them to find out if they need to be shocked before doing CPR. The concept of CPR is just to keep oxygenated blood moving throughout the body so the organs and the brain don't die. Brain cells start to die within 4 to 6 minutes without oxygen, and they are brain dead after 10 minutes. So we really need to get the defib machine on a patient. It's the defib machine that's going to convert the heart into a beating rhythm. If we can get this defib machine on a patient within the first 3 to 5 minutes of them hitting the ground, we can increase their chances of survival 45 to 75%, and that's huge. After the first 5 minutes goes by, the chances of survival now decrease by 10% every minute. So we have an open window of about 15 minutes to get a defib machine on a patient and to get them positively shocked before the chances of survival start to decrease. The average response time in the GTA is about 10 to 12 minutes for paramedics to arrive on scene. So when you're working for the NBA All-Star game or the events that are going on, be prepared. It may take some time for EMS to get to you. So that's why it is so crucial that if you have the defib machine available to you, that you get it on the patient and start the shocking process and CPR. When the defib machine arrives, the best thing to do is to put it above the patient's head. This is our mannequin that we're going to be using for the shocking process. The face is here. This foil right here is just an artificial way for my training pads to communicate to each other so that we can get the desired effect that we want. Obviously, there's not going to be any tin foil or foil on a patient. We want to put the defib machine at the top of the head. This is very important because it makes it very easy for anybody from either side of the patient to push this button. If I happen to put the defib machine on my side here and you're working with a partner on the opposite side of the patient and for whatever reason I can't push this button or I'm afraid to push the button, the natural response for this person over there is to lean over the patient to push this button. If they push the button and they're touching the patient, they will get shocked. Okay? So it is very important that you make sure that if you put the defib machine at the top of the head, it's very easy for anybody on either side of the patient to push this button without coming in contact with the torso itself. So, what we're going to do now is I'm going to run you through a demonstration. We'll put the defib machine on, we'll follow the prompts, and we will do CPR for 2 minutes. There will be repetition here, but I'm going to take you through a full 2-minute scenario here so you can see the process of what's going to happen if you ever have to use a defib machine and if you have to do CPR. So let's get started. First thing I'm going to do, the defib machine has arrived. Turn it on.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
So now what I'm going to do is I'm going to take my scissors, I'm going to cut the clothing and try and get it off the patient as quickly as possible. If you're not ready to move on to the next step.
When patient's chest is bare, remove protective cover and take out white adhesive pads.
So I'm now pulling the pads out of the machine. Here are my pads. Now my pads are a little bit faded versus the ones that I showed you earlier, but they're the same idea.
When patient's chest is bare,
so this pad goes in the upper right corner. So it's going to go right here.
To patient's bare skin.
The other pad goes lower left, down here.
When the first pad is in place, look carefully at the picture on the second. No one should touch the patient.
So at this stage, you take your hands away from the patient, and the machine now is analyzing the heart rhythm of this patient.
No one should touch the patient. Shock advised.
So the machine has indicated that a shock is advised. You can see the orange button here has illuminated. Before I press the button, I'm going to go, I'm clear, you're clear, everybody is clear. You'll push the button and the patient's body will actually jump a little bit due to the shock.
Shock delivered. Be sure emergency medical services have been called. It is safe to touch the patient. Begin CPR. For help with CPR, press the flashing blue button.
So if you do not know how to do CPR, this will give you a bit of a tutorial. So let's listen.
Place the heel of one hand in the center of the chest between the nipples. Place your other hand on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
You will do 30 compressions and then we will give 2 breaths. The machine will give you that information. Obviously we're working with a flat mannequin, so I'll pretend to give 2 breaths. But when you do, you will pinch the nose, you will tilt the head with the chin,
2 full breaths.
Over the whole mouth, breath 1. Continue with compressions. Back on the chest. Now, you're going to do 5 sets. If you were doing CPR without the defib machine, to keep track of your 5 sets, it's very simple. Every set that you do compressions on, look at a body part. Shoulder is your first set, farthest away from you. Leg
Pinch nose,
is your second set. Leg is your third set. Other shoulder is your fourth set. Head is the 5th set. So we're going to breathe.
Breathe. Continue with compressions.
So if somebody interrupted me in the middle of CPR, if I forgot how many sets I've done, I can remember by which body part I was looking at. So right now we've done 2 sets. Shoulder was the first one, leg furthest away from me was the second one. So I'm here on my 3rd leg right here, or my 3rd set, and that's the leg on this side.
Pinch nose,
Pinch the nose,
head,
tilt the head,
and give 2 full breaths. Breathe. Breathe. Continue with compressions. Pinch nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Now, you hear the machine giving you almost like a metronome beat, right? If you don't have a machine that gives you this, one of the best ways of keeping yourself in rhythm is a song called Staying Alive by the Bee Gees. If you're not familiar with this song, download it and listen to the song. That is basically the rhythm we're shooting
CPR.
for. It says stop.
No one should touch,
No one has touched the patient.
Analyzing.
The machine is now checking the patient to see what their rhythm of their heart is right now.
No one should touch the patient. Shock not advised. It is safe to touch the patient. If needed, begin CPR. For help with CPR, press the flashing blue button.
Now I'm just going to turn the machine off here because the machine now said no shock advised. So something that I did in those last 2 minutes by doing CPR changed the rhythm. Now I could have changed the rhythm into 2 things. One, into what we call a normal sinus rhythm, which means that the person's heart rate is beating normally, or the patient went into a rhythm called asystole, which is flatline. The defib machine needs electricity in order to shock. What it is looking for is a rhythm called ventricular fibrillation or ventricular tachycardia. That's why the pads do an analyze. If the machine says no shock advised at any time, look at your patient. If the patient shows any signs of life, the reason the machine did not shock the patient was because the heart rate is beating normally. If you look at your patient and there's no signs of life, they're cold to the touch, they're pale, they're cool, they're clammy, okay? The chances are the defib machine said no shock is due to the fact that the patient was in flatline. Regardless of what it says, if they are not conscious at this time, or they are not breathing at this time, you will still continue doing CPR. Regardless if the machine shocks or not, it will still keep count for you, and every 2 minutes, it'll ask you to take your hands off and reanalyze the patient. There is no limit to the amount of shocks that you as a bystander or as a first responder can give to the patient. You will continually do shocks and then 2 minutes of CPR until such time as paramedics come on scene or a higher medical authority takes over. Okay? There's no stopping. If you can get 4 to 6 shocks in a 10-minute time period, okay, that's going to be something that's going to save these people. 4 shocks will equal about 8 minutes. 6 shocks will equal 12 minutes, right? Because 2 minutes of CPR between each set of shocks. Once you put the pads on a patient, do not remove them. Even if the patient wakes up, there have been cases when patients rearrest. And if they rearrest, you will have the defib pads already on the patient, ready to go to start all over again. When paramedics show up on scene, they will take the pads from your defib machine off and they will hook up their defib machine to the patient. It is very important to try and keep track of how many times you shocked the patient. Some defib machines have the luxury of an LED setup so that it'll keep track for you. This particular machine doesn't. So if you need to keep track, maybe grab a dirt or a pebble or a rock and put it beside you every time you shock. Or maybe draw a line in the sand or make a scratch or something that's going to remind you how many times you shocked the patient while you're waiting for EMS to arrive. They will want to know, number one, How long has the patient been down for? Number 2, how long have you been doing CPR for? And number 3, how many shocks you've given them. If you can keep track of those things, that will help the paramedics in being able to analyze what's gone on and then take the next steps in order to save this person. In some cases, if you're doing very good CPR, the paramedics may even ask you, are you comfortable continuing? If you are, say yes. You can then continue doing CPR while the paramedics can do other things. If you're not comfortable or a paramedic looks and sees that maybe you're not doing great CPR, they will probably say, okay, we're here, let us take over, and kindly move out of the way. If they're a little more forceful, it's because we don't have a lot of time, we've got to get in there and do things, don't take offense to it. All right, we're trying to help this person and save a life. That's pretty much the tutorial on the defib machine, the AED is called, automated external defibrillator. And if you ever have to use this, now you have some idea of what's going to happen in the course of using this machine. So I hope this helps you out. I hope you never have to use it, but I hope you got some good information out of this and it will be useful for you in case of an emergency. I'm Mark Litman. Thank you very much.
Mark, can we ask you one question?
Sure.
A lot of the questions are, so they're in a public area. Are they supposed to be certified to use this, or can anybody use it in the public?
So the defib machines can be used by anybody in the public. The terminology is PAD, public access defib. It's not public access, you need to be trained defib, it's public access defib. As you can see here, if you can understand verbal instruction and you can look at pictures, you can shock somebody. The nicety of what you people have right now is that you've seen a demonstration on the defib machine, which gives you a little more knowledge than the average Joe public person who's maybe never seen this before, or the average Joe public person who's never done a CPR course. But the Good Samaritan Act protects us, and the Good Samaritan Act says as long as you do what a reasonable person would do, you will never ever be successfully sued in the court of law. So if you come across somebody that you think needs a defib machine, and they have to be vital signs absent, or VSA, dead. We don't shock live people because the machine will recognize a proper rhythm and just won't turn on. Okay, any other questions?
Well, the other one is sometimes people don't want to be resuscitated. What happens then?
So for a person who doesn't want to be resuscitated, they will have to have what's known as a DNR, a do not resuscitate order. Now, if they have it in their purses or in their wallets, you may not be privy to that information. You then continue working on a patient until such time as a DNR is shown. As a layperson, as a first responder, you are not allowed to honor a DNR. It must be paramedics, firefighters, or police officers. If a family member is trying to get you to stop working on a patient, try to convince them to let you continue. Only and only if they threaten you in any way should you stop. So if a family member or a friend or someone tells you stop doing CPR or I'm going to knock your head off your shoulders, you have to take that warning for what it's worth. Get back on the phone if 911 isn't there yet and let them know what's going on. You have a vital signs absent patient, you have them hooked up to a defib machine, you're doing CPR, but there's a family member here that's stopping us, we need help. And hopefully fire, police, ambulance will show up on scene, and then it becomes their responsibility. Your medical responsibility for that patient is now done.
Perfect. Thank you very much for your time, Mark.
Okay, thank you, and good luck with the All-Star game.
Thanks.